Rosie Duffield.
Thank you, Dr. Huck, and it is a real pleasure to serve under your chairship today. Congratulations to the member from Hastings and Rye for securing this debate, one of only a handful to tackle women's health in general. Since I came to this place, women's health has been a big focus for me, whether it's the devastating and shocking findings of the Kirkup Review into East Kent Hospital's maternity care, setting up the APPG of birth trauma, the plight of women who now have no recourse to any health care or medical treatment in Afghanistan, the women whose health and well-being means precisely nothing to the warring factions in places like Tigray, the tenacious mothers who have tirelessly fought for changes to sodium valproate labelling, female cancers, vaginal mesh, menopause, the mental stress and health toll on WASPs or 1950 women, FGM, domestic abuse survivors, all of these and so much more are health issues that affect the majority of the population who are female. And for the avoidance of doubt, let me be clear, by female, I mean women, adult human females, the kind who have a cervix and who definitely do not have a penis. Despite being 51% of the population, women's health services are frequently deprioritised, with the healthcare model based on a default male, with women existing within a system built around men. Inequalities in health outcomes between men and women are frankly scandalous. Women are more likely to experience common mental health conditions, are more likely to be misdiagnosed, are more likely to receive less pain medication after identical procedures, and are more likely to be undertreated for pain by doctors compared to men. A perfect example of how women must exist within a healthcare system built for men is heart attacks. I have recent experience of this with my dear friend Nikki Clark experiencing a heart attack in January. She's now tirelessly campaigning because women are less likely to be admitted to hospital when they complain of chest pain compared to men, and have more than double the rate of death within 30 days following a heart attack. Medical professionals know that heart attacks present very differently in women compared to men, and yet the classic symptoms are listed in campaigns as specific to men only. Recent trends in the collection of data highlight how vital the accurate recording of this is in a medical context. Women's health issues all arise from our specific biology. A man cannot get ovarian cancer and a woman cannot get prostate cancer, for example. And while it may be considered good manners, kind and courteous to refer to those who identify as a different gender in the way they prefer, for the specific purposes of recording vital and potentially life-saving data, we must accurately record patients' biological sex. Otherwise, trans patients may miss being called for screening for sex-specific conditions, and that has potentially fatal consequences. This has been highlighted by Professor Alice Sullivan, who was commissioned by the last government to tackle the issue of recording sex data, including in the NHS. Her review is due to be published, and I'd be grateful if the government could confirm the date for this as soon as possible. In the last 7 years, we've had 7 Secretaries of State for Health and Social Care. It's very hard to get even on the second rung of a ladder when you have to start all over again with explanations, evidence and examples relating to a campaign or specific health issue when every few months the departmental personnel and teams change so very often. So women here will keep campaigning, keep holding debates to push women's health further up the agenda, and I will keep working with the Birth Trauma Association, MASIC and others to help end the postcode lottery and extreme inequalities for Black and South Asian mothers experiencing what should be straightforward and perfectly safe childbirth. Thanks again to all those parliamentarians, campaigners and activists who won't just take no for an answer and who fight every day to bring about better experiences for other women.